Hey guys, Dr. Don here. Welcome back to the channel. So today I want to talk about a condition that affects many people here in the United States, especially women. And this is a condition called fibromyalgia. Now, regardless of what certain people say about this condition, that it's all in your head, it's a made-up condition, you're just in a lot of pain, I would just disagree with those people that are saying these comments because, you know, I've come across a lot of people over the years that have dealt with fibromyalgia, and it is a real condition, and it is something that really devastates people's lives, mainly because of the pain. But fibromyalgia is also associated with a lot of other conditions. A lot of people that are dealing with fibromyalgia, yes, they have this widespread body pain and body aches and joint pain, but it also can be associated with chronic fatigue to where they're just always so tired. Fibro brain or fibro fog, so some just major brain fog is also could be associated with fibromyalgia. A lot of times there's irritable bowels that are associated with it. There's a lot of other conditions or a lot of other symptoms that is associated with fibromyalgia and really is different with everybody that deals with this condition. And so I'm going to talk about, you know, what really drives fibromyalgia. I want to talk about how it is that we're able to get people to become symptom free and really educate them on the steps that they can take so that they don't have to be in this pain every day. I want you to listen to this testimonial of one of my favorite patients and just listen to what she says, not just the results that she got, not just the pain that she got out of. And at the end, she talks about getting her life back. But talk to her, listen to her talk about her frustrations with all the doctors that she saw over the years. So listen in, I'll be right back here, and then we can talk about more of the nuts and bolts about the actual condition and how it is that we get these type of results.
I was diagnosed with fibromyalgia 27 years ago, and during this past 27 years, I've seen 3 different doctors, and none of whom ever said to me that we will get to the source of this, Jane, or talk to me about my diet or the inflammation that was going on in my body. They always just gave me the latest pharmaceutical drug to hit the market, all of which made me deathly sick. The side effects from all of the drugs was devastating. So I just kind of had to wing it along on my own. And when my last doctor said to me she had nothing else to offer in the way of how to deal with this, I knew I had to find somebody. And so a friend of mine recommended Dr. Miller, and the first thing he said to me after talking with me for a while was, we will get to the source of this. He's talked to me about diet and what diet can do to the body as far as inflammation and so forth goes. And I feel like he's handed my life back to me, and he's given me an awareness that no one in the medical profession could do in the 27 years that I've been dealing with them. And I've really just kind of lost faith in the medical profession right now, and I'm ever so grateful to Dr. Miller for what he's done for me. He's handed my life back to me is what he's done.
All right, guys, so fibromyalgia is known as an autoimmune condition, meaning that the problem is not the pain that you're experiencing. The problem is not the fatigue that you're experiencing. The problem is not the irritable bowels, the constipation, the diarrhea, the bloating, the gas. The problem is the immune system that is leading to all of these abnormal symptoms. Now remember, if inflammation drives all disease, when you have an autoimmune disease, it creates a tremendous amount of inflammation. And so we know of a lot of autoimmune diseases out there like rheumatoid arthritis, Hashimoto's thyroiditis, lupus, multiple sclerosis, fibromyalgia, right? So fibromyalgia is typically diagnosed. There's the different spots on the body. There's 18 different spots that they test. You know, if you're positive in 11 or more of those spots, typically you can get that diagnosis of fibromyalgia. Now, at the end of the day, as you all know, I don't treat symptoms, I don't treat disease, I don't treat the things that you've been labeled with by your medical doctors. My job is to get your body back to functioning in a normal state. See, if our body's functioning normally, our immune system's functioning the way it's designed to function, then that immune system is not become aggressive against different parts of your body. And again, that's really what the autoimmune disease is. That's what it means, is the immune system now sees parts of your body as a foreign invader, as if it shouldn't be there. So with Hashimoto's disease, it wants to attack that thyroid gland and those thyroid hormones. With fibromyalgia, it likes to attack those peripheral nerves and muscles. With rheumatoid arthritis, it likes to attack those joints. Multiple sclerosis really affects the motor portion of your nervous system. And so again, the autoimmune diseases affect different parts of the body. And so a lot of the frustration that you heard from Jane is when you go to a conventionally trained doctor, they're going to focus on the symptoms, okay? They're going to focus on the symptoms of that autoimmune condition. And so instead of focusing on the pain, the fatigue, the joint pain, the body aches, all the things that she was dealing with for so long that just devastated her life over the years, she finally found a doctor that was able to arrest that autoimmune disease by fixing the problem. And so, yes, we talked to her a lot about diet. We did food allergy testing to remove those triggers. But most importantly is we went in and we truly built the foundation of our body's ability to heal, the foundation of our overall health and wellness, which really comes down to our gut health. And so with the comprehensive stool analysis that I do, it takes the guessing out of the game. It tells us exactly what is going on inside of your gut that has led or, that is influencing this autoimmune condition. So, obviously it was a step-by-step process and it was very individualized based off of what she needed as an individual to get that immune system modulated, regulated, and functioning back in a normal state. And with that is when you see the type of results where she feels like she got her life back. And I get chills, every time I watch these types of videos because, sometimes I take for granted what I do because I've been doing this for so long. But when you have somebody tell you that they struggled for 20 years and they were in this pain and they had this fatigue and these irritable bowels to where she was uncomfortable going to certain places outside of the house, and for her to look at you and say, "Doc, you gave me my life back." Man, that's what drives me every day, guys. And so just know that, covering up the symptoms, whether you're doing it with medications or with herbs, it is not the answer. You need to get down to what's causing your autoimmune disease, what continues to trigger the inflammatory responses. And once you normalize function in the body, the beautiful thing is the symptoms go away and you get your life back. Guys, listen, share this video, give me a like on this video. Remember to always subscribe to this channel, and we will see you guys next time.